uh, afternoon, whatever you are. Welcome to this webinar regarding the surveillance data systems and tools integration to improve analytics for early detection of outbreaks, systems integration, and interoperability. So before starting the webinar, I will give the floor to Amarachi to go through the welcoming and housekeeping. Thanks. Amarachi, over to you.
Good morning, good afternoon, good evening, colleagues, wherever you're joining us from. My name is Amarachi, and I'll be taking you through just a few housekeeping to enable us have a fruitful conversation today. WHO is committed to enabling events at which everyone can participate in an inclusive and respectful and safe environment, and we are guided by the highest ethical and professional standards. And all of us here today are expected to behave with integrity and respect towards each other or any WHO event. We are allowed to disagree with each other or to also give inputs, but as we do that, may we do that respectfully. Next slide. We have interpretation in English, in French, and in Portuguese. And if you look at the bottom of your Zoom screen, you're going to see a globe icon that has interpretation on it. You click on that and it's going to give you the available languages, and you can, move between any of them depending on the language that you want to listen in. And you can also mute original audio so that you have a seamless experience in there. You use the Q&A for questions regarding the topic, the presentations, or the subject matter that we're discussing today. However, you can also use the chat for general introductions. As you have joined us, please put in your name, your organization, and where you're joining us from so that we can also know how to interact with you best. There's also a raise hand feature if you look at the bottom of your screen. So when it's time for the live Q&A on the agenda, Sally is going to let us know. You can raise your hand and speak, and you'll be given access to speak and interact with the panelists directly. Next slide. You also note that by participating in this meeting, whether as a participant or as a panelist, we take your attendance as permission to record your contributions and share them via our various learning channels for continuous learning purposes. It can be on YouTube, it can be on LinkedIn, it can also be on other channels that we use for learning. The session materials, which will include the recording and the presentations of the day, will be shared in the days following the webinar. Next slide. If you remember when you were registering for this session, we collected a few data information from you. And those registration questions, the chat comments, even your name, your organization that you're going to put in the chat as we are discussing, the data is between WHO and ECHO and our partner ECHO India. That data is kept confidential. The data will be used for reports, for some maps, for communications, for surveys, for quality assurance, but this is also de-identified data. You will not find your name or anything anywhere because the data is going to be de-identified for this report. Next slide. I'm just going to quickly take you through the agenda, and then I'll hand you over to Dr. Saliu. Our moderator for the day is Dr. Saliu, who started the call earlier. My name is Amarachi, and I've just completed the housekeeping with you. We will have welcome and opening remarks from our PAM, Dr. Etienne. I'm not sure that Dr. Salam is on the call today. And then Dr. Sali is just quickly going to run you through the objectives and the expected outputs of the webinar. Shortly after, Dr. Etienne, who is the PAM for the HIR team, it's going to do the overview of surveillance e-tools for detection and analytics. And then Gilbert is going to take us through demonstration of the DHIS2 platform for IDSR, signals, and event management. And it's a very short session, so immediately after, we're going to have the Q&A session that will be moderated by Dr. Emmanuel Zutzi, who is a consultant on the IDSR team. After that, we're just going to have closing remarks and next steps from Dr. Etienne, who is our PAM. And that will be all from me. Over to you, Dr. Saliu.
Thank you very much, Amarachi, regarding those housekeeping. This is well noted. So welcome again, dear participants, to this webinar. Actually, this is a webinar series regarding IDSR improvement in the African region. As you know, one of the components of IDSR is EIDSR, meaning that we will use digitalization to improve the data collection, data analysis, and data sharing between facilities to district, national level, but also with Afro and with other partners. Now, regarding this webinar today, let me give the floor to Dr. Etienne, who will be opening the session. I'm Dr. Saliu Jallo. I'm epidemiologist and disease modeling specialist. Actually,
thank you very much, Dr. Saliu. Welcome to everyone. Dr. Abdul Salam Gay will not be able to attend. As you all know, we're having our new RD this week. And so we're already in several meetings. But I want to take the opportunity to welcome you to this important webinar. Surveillance is really the cornerstone of what we're doing in Africa to prevent, detect early all the risks that are being posed here on our continent. So surveillance is very important, but how do we actually do it? What do we need? How can we improve our processes to be able to detect early is the subject of this webinar. This will be a very good opportunity for all of you to engage with the team, to see what is out there that can be used, adapted to the context, and how we can best support the member states. So I'll not take very long, but on behalf of Dr. Salam, I just want to welcome you and really wish you a very fruitful discussion throughout this webinar. Thank you so much. Back to you, Salam.
Thank you very much, Dr. Etienne. So now let's move to the objective of this webinar. So today we'll talk about one of the components of IDSR, which is the EIDSR. So the general objective is to demonstrate the use of the new WHO Afro IDSR electronics tools and platform that have been put in place for the member states. So specifically, the first objective will be to present an overview of the DHIS2 platform for IDSR. We will cover the indicator-based surveillance parts, but also the event-based surveillance parts. And we will demonstrate how to use those two systems. After that, the second objective is to provide links to all participants so that they can access to those tools. And finally, we will discuss regarding the challenges and the way forward on how to implement and to use EIDSR for Africa. So those are the objectives of this webinar. So without wasting many times, now let's move to the first topics which will be given by Dr. Etienne, who is actually the program area manager regarding the health information and risk assessment unit. Dr. Etienne, over to you.
Thank you very much, Dr. Salu. I hope you all see my screen. I'll take a couple of minutes to go through a number of slides, basically to set the stage for the discussion, but also to really provide an overview of what we are talking about when we're speaking about surveillance tools, electronic tools, what is out there that can actually be used to support your work on the ground. As you know, we're dealing with a lot of data, and it's always important to have that in mind. Most of the countries in our region have now been onboarded on media monitoring through the EIOS, Epidemic Intelligence from Open Source, which is now becoming very popular and will, of course, increase our capacity to detect early. We're talking about large volumes of articles being screened every single day. This is generating a lot of data. We have our IDSR strategy, which is adopted by all the member states and being implemented. We have quite a century of experience with that now. We store the data in terms of the actual public health events that have been confirmed. So that's another set of data sets. As you know, every year we have basically on average more than 100 events. Just as a reference from just last year, we got 145 events, which is quite a huge number. We have laboratory data sets. We have a genomic surveillance, genomics sequencing data that is being also generated. Of course, with the capacity that is coming up on the continent. We have other type of data sets, population data. Of course, we cannot do surveillance without understanding what is out there in terms of who we are talking about, the population. We have environmental climate data sets that are out there. So just to say that we're dealing with a very large volume of data every single day. Now, when we speak specifically about IDSR, just to give you a little bit of perspective, because when you're at the country level, you may see your weekly data from your districts, but perhaps it's important to also see what we are dealing with in terms of volume all over the place. And so what you have here, all of these red dots are representing districts from which we're receiving data every single week. We're talking about almost 18 million square kilometers, almost 6,000 districts. As you can see here, the number of districts per country. In some instances, you have more than 700 districts. So we're talking about very large volume of data. And then, with the population that is combined from all of those places, you can see, that we're dealing with a lot of information, and how do we possibly can manage the information is critical to improve our surveillance systems. So that is really exactly what the objective is how can we improve that? And so I have mentioned the IDSR, which we've been implementing since 1998. We're now implementing the third revision, third edition of the technical guidelines, but there is more to do. We know there are gaps. And so Afro decided to bring in what we call the Transforming African Surveillance System, which is really a way to improve how we run IDSR on the ground, focusing on more the digitalization piece, the electronic part of it. How can we possibly improve the processes that I just described, which is becoming very, very heavy. And so throughout the implementation of TAS, and this is just to remind you, but we all know what has happened. We had several surveys conducted. We have progress reports. So there is a good understanding of what is really out there as challenge to implement IDSR. When we say geographic coverage, are we talking about all the districts in the country? Out some areas, are we having the capacity in terms of laboratory? Do we actually do integrate community-based surveillance, event-based? Are we really implementing One Health surveillance? And then, of course, what are the tools, and do we have enough tools, or powerful tools that are going to help us improve that process? And so it's all really around leadership and advocacy. So we know those challenges that have been really emphasized throughout the surveys and all the reports. So as a summary, scaling up is important, but also with data management, the capacity to analyze the data, the capacity to do sequencing, and of course, how do we monitor those processes to know what is going well and what needs to be improved over time, and with the policy and coordination part of this whole process. And again, this is just as a background to summarize what we have all done together throughout the last 3 years, basically. The workshop, this webinar is part of those series of webinars that we have conducted. The assessment that I mentioned, but also the regional workshops. We conducted 3 regional workshops. So all the member states were involved by sub-region, West Africa, West Central Africa, Eastern Africa, and Southern Africa. So we worked hard together to understand what are the gaps and how we can improve those. How can we actually target specifically those big gaps to achieve the goals that we are all looking at. And on the other hand, we have also been moving very fast on implementing the EIOS, Epidemic Intelligence from Open Sources, which is really contributing a lot to our detection. Currently, we have 42 countries onboarded, and the idea is really to use that powerful tool to help with the detection. So having said all of that, we really want to congratulate everyone because we made a lot of progress. Back in May 2022, when we looked at the way IDSR reports were coming in AFRO, it was really difficult. We understood it was really right after COVID, and of course the attention was really focused on COVID, and we are losing the ground basically in terms of routine surveillance. And so with all the work that we have done together, the discussions, we started to see improvement, and currently we're seeing much better picture of our reporting on IDSR, which means the data it becomes more available, and also countries are being comfortable sharing the data. And we have looked at some of these very important pieces of data to see the progress in terms of completeness and also timeliness. Timeliness, of course, is still low because we're talking about weekly data, so we should really have the data in every week to be able to use it and to take decision out of it. But we're also seeing that if you use the data and look at your threshold analysis and so on, we're also making progress in terms of the time we spend to detect. So for example, in this particular case here, it was from IDSR data that where analytics were used, it took only 3 days on average to detect the outbreaks, which is very good. And so this is really a summary, and just to say that these are areas we all need to focus on and to improve on. So in AFRO, as we move on, of course, through the discussion that we have had with all of you, we started thinking of what is really needed to improve those processes. And these are some of the tools that we were thinking of. Of course, you have the the number one thing that everyone from the first webinar mentioned was, can we have some sort of regional IDSR platform which can store all the data together, facilitates the analytics in the region, but also countries can actually use it to build or strengthen their own systems and so on. How can we visualize those data in a very easy way? For example, some sort of panoramic view throughout. And then how can we visualize the signals, the events, and track them when they get confirmed, for example? How do we store those events so that we can actually learn from our historical event database? And then there's a component of how do we visually see that on the ground, and we use some of the GIS tools to see what is out there and visualize the challenges on the ground, and how do we get all of this all together basically into some sort of platform. So we've created this link here, emergencydata.afro.who.int, from where you can access any of these tools, but also all other documentation that you're looking for. So this is a place where you can go and have access to everything that might be useful in your work. Now, speaking about integration, and I talked about different pieces, but the most important thing to do is really how do we connect all of these pieces together. And so that's where the interoperability part comes in. Integration, how do we link things together is really critical. So for example, when I started, I mentioned the media monitoring, which is generating a lot of data. So what do we do? Where do we store those signals? And when they become events, how do we do that? So, having a DHIS platform, for example, is critical, and we'll have the opportunity to see it. I'm just giving the overall overview. The weekly IDSR data comes in. We want to make sure it's stored and processed. And other sources would be from the lab, the One Health aspects. So all of those should be stored somewhere in the same platform, or at least connected into that platform, with signals also, being injected into that platform. That's what we're discussing. We made a small application out of that for the Central Economic Community of Central African States, but that's a particular one, just to say that we can also, extract and build a subsystem for a sub-region, for example. All of those events, when they get confirmed, have to be stored, what we call the event management tool, from the other sources. Could be the IHR notifications that come in, some of other notifications from the country office, or other internal communications also generating data that gets stored. We're capitalizing all of this into what we call the old outbreak legacy data. So basically, we don't want to lose track of all the data we've been dealing with since the creation of WHO. And so this is really a new project that we are embarking on. Altogether, we have to work on documenting some of our past experiences so that we can continue to learn from. The panoramic view is really how do we visualize all of this into a very simple way that does not need, a lot of skills from, computing, but just to visualize the data. And so all those events have to be also tracked, and that's what we call the event tracker. You'll see it in the demonstration. And then finally, how can we build a collaboration across so that we can learn from what we are all doing, for example, if we're talking about cross-border surveillance, etc. Yeah. Sorry. So from that, we have to consolidate, the surveillance systems. And so one thing, also a piece of information is that the Dakar Hub has what we call an excellence center, which we call the data sphere, which is actually contributing to resolving some of these issues, integrating the data, having surveillance systems that talk to each other, also the capacity building, etc. So this is an opportunity that I want to take the occasion to actually say it, because this is out there, and you can always contact Dakar Hub for more collaboration on the ground, whether it's a training, other sort of support that you need. And so we're getting now to actual tools, and you will see it in the demonstration session, that the tools have to be talking to each other. That is our priority. So from the IDSR platform, where you will see some of the tools that we are building in terms of how do we automate the alert threshold analysis, for example, for detection. How do we communicate when there is an alert to the countries, for example, out of that system? How do we store those events and look at it every single day, see what are the new signals, what are the new events, and how can we manage to see if our teams are on top in terms of verification processes and so on. The EROS generating data, how do we connect those to what IDSI is also doing? And then finally, how do we visualize all of that to make sure are performing well in terms of tracking the events and signals that are on the ground. And so Gilbert will go through this, but basically I will just go very quickly through some of the screenshots to summarize a bit of what I have been describing. The centralized platform is one thing. We know countries have their own systems, but how do we get all of it together is really what we call the centralized IDSR platform. And then, of course, some countries can, take some of these tools, adapt to their own context, and that is the objective, really. Currently, 32 countries are using the platform to submit the weekly data directly. As soon as they submit the data, they get access to all of these analytics. And so this is really something we wanted to emphasize, to say that it is out there, and we want everyone to make use of them, at least integrate them where possible into what you're already doing. I mentioned the panoramic view of the IDSR. So, in a single click, how can I see what is going on in terms of the data that I've been collecting, throughout the weeks? And so, for example, what are the trends? If I look at a specific disease, what are the risks? So basically looking at a risk calendar, for example, the seasonality by disease, but also really checking the monitoring of the reporting from the ground, for example, at district level. Yeah, the tool is also meant to help generate bulletins, for example, the IDSR bulletin or AP bulletin that the countries generate. So how can we facilitate that process so you can actually generate the data already with some of the graphics, and you can go in there and add additional comments or text to finalize your weekly bulletin. The signals and event, this is important to see how we are doing week by week, but also daily, what are the new signals that we're trying to track, and how our teams are actually doing it. So this is very critical, and what is important is how the verification process is ongoing, and so what kind of action our team needs to take to make sure we don't miss any signal under verification. And then, when those events are confirmed, so what are we looking at? So, documenting what is ongoing and making sure we understand actions that are being taken for those particular events. Gilbert will show you in more detail all of these, but that to summarize that the critical piece is once you have your IDSR data, you have events confirmed, we track that. So basically being able to go line by line, see what are the events and what are the specific details of these events. This is the kind of information that is needed to really improve what we are doing in terms of And this is an example of our own team, making sure we are tracking events, and if are very late, are very on time. These are some of the tools these are perhaps internal to our team, but we can imagine the same can actually be done locally in country to make sure that you are tracking the events signals on the ground. And then, of course, monitoring all of those events, tracking them, understanding the details of specific events. The objective is not only looking at country, but also hopefully understanding what is going on around your country, understanding what is going on around the region. And so, and I will finish with these last few slides. Once we have a data, what do we really do? Once we have integrated all of those together, how much can we use the data? So one thing is to do advanced analytics. So for example, modeling, to try to understand and forecast things that might happen, looking at climate change impacts, for example, the cross-border aspect. So there's so much we can learn from the data we're collecting. And of course, also supporting the ongoing outbreaks on the ground. And I'll just show you a few examples of how important it is to have a data, is to, for example, in this particular case, understanding the 2 decades of data and seeing what is out there. Basically, if I'm talking about Mpox or Melbourne, where am I seeing more occurrences of those events? And so some sort of mapping of those events, and what are the most probable areas that might actually have such events, for example. We're also looking at what we call the feature importance. And these are just examples. What are the probabilities of things happening where and why? And what is that playing in terms of predicting some of those events, looking at environmental factors, for example. But we have to have a data for it. And that's where IDSI is important. In a specific case of cholera, what are the trends and so on, understanding where are we going with this, looking at other variables such as water, sanitation, and hygiene indicators. To finish, climate change, of course, I started saying that it's also playing a lot in terms of occurrence of outbreaks. So, but what are we talking about and what are we seeing? So these are very important questions to try to understand based on the data that we have. Another example is the cross-border surveillance, which we did for the Central African states through a specific project, through the DSA project and the World Bank. But this is going to be important. So we're going to share the information. Now we will have to start sharing information across borders across the point of entries. This is something that is available already, and we can encourage countries to build on top of it to analyze the data. Yeah, I will stop here, and thank you very much. Back to you. Sorry, it was a little too much, but basically the idea is to set the stage, give you a big overview, and then of course we can go into the more specific details. Thank you very much.
Thank you very much, Dr. Etienne. This is really a very helpful, useful, and greatly appreciated. As you can see, colleagues and participants, this is a system. This is a one consolidated system where we can have everything. So you can see that the data management, data storage, data analytics, but also the automation using AI and advanced statistical analysis, all those are integrated into this one systems. So on that, we can really reduce the manual process. So getting data manually, analyzing data manually, we intend to stop doing that and to automate everything that can be automated. This system is interoperable with all the other systems that are actually in place at country level. We are working on it, but also this system can be accessed by the countries. So this is really a great improvement regarding IDSR implementation in the African region. So Dr. Etienne also talked about the data sphere or the Center of Excellence that are actually in Dakar. The center is here for all the African region regarding all those aspects that have been presented here. We will give you the link also to access to the people are sitting in this Center of Excellence who can help countries to have access, but also to use those systems. And finally, you can see that using the system, there are already many outputs that have been obtained. We have an increasing regarding completeness, regarding timeliness, but also regarding detailed analysis. So this is a great achievement. Now, let's move to Gilbert, who will go through those systems in detail to show you how this work. So, Gilbert, over to you.
Thank you, Dr. Saliu. Good morning or afternoon, depending on where you are, colleagues. As Dr. Essen, mentioned, this platform was designed to address persistent challenges in disease surveillance, including fragmented data systems, delayed outbreaks detection, and also sometimes limited analytic capacity. So by providing this centralized, interoperable, and intelligent infrastructure that links member states, WHO emergency hubs, and the Afro region office in real time, it was really, now it's showing that we are having too much data that can help in making more analysis, which sometimes inform in planning, but also in disease surveillance. So over the time, we've been working on this platform. We started some time back where we had some calls with the countries trying to inform them about, the platform, the intention, and how we need their support to move this forward. We had some work trying to align the system with how the reporting was done. As some of the reporting was using Excel files, and each country with its own way of reporting, and we tried hard to align on how they report without going into changing how they were doing things. So we are happy that now we are moving to reaching all the countries, and we believe with the remaining countries, within a few months, we all be able to have all the data from member states. So the platform, even though being on DHIS2, we developed further applications that make it possible to meet our needs, our team's needs, but also to cater for the current technologies. Here we talk about artificial intelligence, machine learning, which are helping providing automated threshold analysis, whether there's some anomaly detection, but also to enable proactive outbreak alerts based on dynamic and the context of specific baselines. As I present, we see the current situation, how far we've got in terms of features we have in the system, but also it's an opportunity to discuss with you the surveillance teams from country offices, partners who have been engaged within this on how we can build on the current status, but moving the system further, because the system evolves with the time. And without your feedback, we can think that we have reached where we want to be. So we are excited to engage with you, gather more input, and continue refining the platform to meet evolving needs of this surveillance within the region. Without further ado, I will share my my screen to show you, to run you through the system, and will be available for further discussion. I have some questions, some recommendations on improvement, and whether you want us to reach you even after the call to see how we can stay engaged in supporting you. Okay, so as I said, it's powered on DHIS2. One needs to have username and password, of course, to log into the platform. I'll log in with a higher login, I mean, so that we can see more of what the tool has and the potential of it and what we are looking further to do with the platform. So once you log in, there's a dashboard that was customized for our regional teams, but also for country-specific dashboard. So if you log in as a user from Nigeria, as a user from Ivory Coast, you will see a specific dashboard that is aligned with the country that you are signing from. So this is to cater for even data confidentiality and some policies that may be limiting maybe for some countries to access other countries' data, but also it's a good practice because it's better to have two levels of system access to ensure that no one is accessing what is not supposed to access. So always the starting point, we design the way of uploading data, as I mentioned when I started. So it's an application that also was developed, to align with the country's format. So one has to select, the year, then the week you want to report on, and then you have to confirm your country. And then the next one will be to go and just choose your Excel file. Then once it's chosen, you just click on import data. And that will be a process that will take, in most cases, it's some seconds, and it doesn't go further than 2 minutes or 3 minutes for countries that have many districts and so on. So the more you have district, the more it take time to have data ingested into the system. So to make this possible, as I was saying, one has to have his data format aligned with how it was configured in the system, because for each country we work on on their format, and we ensure that the diseases they report on are configured in the system, but also their geographical or admin levels also are configured in the system. Sometimes there can be a change of district name or the boundaries and so on. So we always remain available with the country teams to apply those changes to make it possible for them to upload data normally. And the system has been built to show some errors. So if you are trying to import some data and there's some issues, the system will tell you. So when you import your data, there's first an email that is sent back showing you the threshold. If you have maybe some cases that have gone over the normal ranges, so it will give you a list of districts and the cases that are in question, inviting you maybe to review if there are no data quality issues, or if it's true, to get in touch with the surveillance teams within those districts to ensure that maybe there's no a problem in the making within that specific district. But on top of that, from that notification, we also from our side have this dashboard. So when it lands, you can see, because we even have data for previous years, you can have some statistics for some key diseases, looking at what we're maybe for this year, 2025, how far we are with some cases of different diseases and so on. But also you can refer to previous years' data. And we have also comparison for every week. For example, if we may need to see, what happened maybe in week 23 compared to week 22, then we can see some changes and so on. But also, it gives us a way, in a simple way to see the threshold analysis. For example, if we are in this week, this is for the country that they have already reported for week 25, because it's still in the reporting window, so we don't have as many countries that have reported for this week. But still, you can see that, we have some red, meaning that if, for example, I click here on diphtheria, I can see some countries that reported some suspected cases of diphtheria. So in this way, we can ask ourselves, are we having many cases of diphtheria in Niger, in Cameroon, and Mali? So then we can make further contacts with them to check if all is okay. So the same for other, can be for cholera. We have some countries that have it as an outbreak. So still we can see if there are no new countries that are having also these suspected cases of cholera. The same for meningitis and so on. So this makes it easier for our teams to spot these diseases that may be having these high cases, and then they can make subsequent follow-up with country teams. And below also we have a table that shows for the last 9 weeks what has been the situation for different countries that reported using the platform. So here, if we see red, that means that we have some threshold, and some diseases that have gone beyond the normal threshold, and inviting us to check whether for a specific week there's no problem. So for example, if you click on in a specific cell, it will open up a threshold analysis and show you the list of diseases in question. But also, because you can keep clicking, in each cell, you can export your data in Excel. Then you can even look for a specific week and a specific country. And we have also, some graphs that show how many, what are the countries with a high number of diseases that are concerned for the threshold analysis and MAP along with that. So this is like the main dashboard that can give us a snapshot of what's going on. But from here, we can get the best use of our data. We have like this link that's called trend. So one can come here and look for a specific period, and then if you want maybe to look for data for a specific disease, for a specific country, even for a specific region, for our teams that are working in different region. So whatever choice or selection you make, data will be displayed down here, and then you will be able to see the result of that. So by default, it will show me for the current year from week 1 to week 26, all the countries and the diseases they report on, and the statistics of data they report on. So, and this can be also exported for further analysis for our teams who wants to do other analysis, like we said, modeling and so on. Along with that, also we have ways of checking, who has reported, who hasn't yet reported, so that we can make further follow-up and ensure that we are making good coordination. So whatever you see red, it's countries that don't have data in our platform for these specific weeks. If you don't see your data, it doesn't mean that we don't have them in our position at Afro. It means that we haven't yet incorporated them in our platform. I mean, like for Ethiopia, which we are still trying to figure out how to drill it down to their admin levels, because they are specific for their context. So this makes it easier for us to make follow-up with countries and ensure that, we are having timely reporting and ensure that, if there are countries that are late in reporting, we can get in touch with them to invite them to report again. So we have also included what you are still refining, what we call a risk calendar. This will be a way, of from data, but also data collected from countries, but also from data we have within our system, trying to see, for a certain country, what is the period of the year they may experience a certain, outbreak or, a certain jump of cases for a disease. So from here, we'll be having some notification that should be pushing in terms of email and SMS to concerned teams within countries, also partners, to inform them on, for preparing on time ahead of a certain outbreak that may happen within that specific period. So it's a work in progress. We have already incorporated this data, but we believe we move it further to make it more efficient to inform countries on time for preparedness and so on. So as you can see, we have, some other links that are not active. So it's a work in progress. We are still, working on making the system more useful, where we can have some collaborations, some chats, and so on. And we believe, as we get more feedback, as I said, we improve the system because we get more insights from you. It's there to serve you. It's not for only Afro. It just for the whole region. And I believe that this data we serve for the purpose of countries, not only Afro. So this was for our IDSL data that we receive, every week, and the use of it as we get it. As we said, from this data we link to other various systems. They can be GIS enabled, systems, Power BIs, and other analysis systems that make it easier to make further analysis for our teams who are in research, but also who want to do maybe a focus on a certain disease and so on. So it's helping within countries that have been able to be active, in giving us this data. You can see that, we started from far, but we are getting, to where we want to be. The data we've been sharing are being useful and they are helping. For example, I remember some weeks back, we used this threshold analysis to spot cholera in South Africa. And through our other normal channels, we hadn't, spotted it. So this is one of the ways, even though we have other systems we use like EIOS and some other reports, but also these from the data we receive, it can inform to take action in time through this threshold analysis. So this is one of the system, but on top of this also, as I mentioned, I go through quickly, we have another system that we call signals and events management system, which is a tool also that will be put in place to make efficient of our public health intelligence teams on how they follow signals and events that have been detected through different channels of work. So, however, we're trying to automate these systems because our end goal is to make it easier for our teams to work in an automated way, but also to ensure that we work in real time, because if we have data, we have to record again, and we do some other work on top of that. It won't inform us on time. So we are looking further to integrate this platform with other systems like iOS, some country level systems, but also even support countries who may need to use these systems to get access to them and support them as much as we can. So when we receive from different channels of reporting a signal or an event, we register it. It can be an event or a signal, and depending on it, we create it with this basic information. But also, we have a way of tracking it over time. So When we create them, if it's a signal, we have, of course, a dashboard where I can have, all our past and current signals. So they can be of different tab. We have some that can be that already confirmed, some that are under monitoring and other pending verification. So our teams get it easier if you come, for example, but you get here, a high number because they are from a big period, but we can also look at, a specific week. So if I click on, for example, under monitoring, I can see the list of signals under monitoring and some that are maybe pending verification, and any of the box here, so that we can easily spot what our teams are working on in terms of signals. But so when a signal is followed up, for example, if we have this that may be under monitoring, we have ways of opening it, then I was saying track it over time, and depending on the status of it, we can change its status from maybe under monitoring to another status or as confirmed event. So if you confirm an event, it's automatically created as an event, and it moves from a signal to an event. And when it becomes an event, then it gets list. It gets from the signal, then it moves to the list of events. We have also, the list of ongoing events and closed event. So you will see that we have ongoing, but also we have the whole list of past events. And we have what you can do. For example, if you have received a certain signal that was confirmed as an event, or even an event that came as a confirmed event without going through the process of signal management, then you can have a way, of opening it, and you can track it over time, as we were doing for the signal. So there are some key information that we collect. Can be the basic information is correct when we are creating these event, but also we have some other information that we can keep, tracking over time, depending on how we get, information from our teams. In line with this, we are also working on, how to make a proper follow-up on, when an event becomes an outbreak that needs, proper follow-up. So we, for example, for cholera, we have another tool that we built on top of this. For example, if I click on cholera within Angola, I can come here on this other tool where I can make proper follow-up just for cholera. So if I land in, I will see all the case of cholera for all countries, but I can go on a specific country. If it's for Angola, then I can see some statistics on cholera. Of course, we are also working to improve it better and make it useful. And we believe that, as we get to cater for main outbreaks, we have a more expanded system to not even manage cholera, but also other outbreaks in, that we are working on. So when we have this, we have ways of, our teams can come in here and see, how many events are ongoing. And they can also see some information. If they have maybe some discussion, they can add some note, to ensure that they're having a proper communication internally and easy, improve their way of communicating while following a certain event. But also they can, make some easy updates without going further to open up, the whole event and make some updates. And along with that, also we can have some reports. We have our daily reports that we provide with details on what happened for events we received and signals we received, but also some other weekly summarized report that we generate to send to specific teams to inform them on in an easy way on what's going on. We are improving further to create some notifications that I was saying to automate some reports to inform, our teams and even some countries in an easy way. Yeah, so along with that, our teams also, we have ways of, tracking the events and so on to ensure that we are on time in what we are doing. And we are making it easier for teams to work in this angle. Yeah, so these are two ways of how we are working on ensuring that, we have information. We can get some data from IDSR that can inform us through threshold analysis and a potential outbreak, but also we have ways of, tracking over time these outbreaks, ensure that, we are in line and we are using the best practices in following these outbreaks to ensure that nothing spreads further within a specific country or region. Thank you for your attention. I'll be happy to receive, they said, your questions and try to attend to them, but also, your recommendations will be of great importance as we try to, to improve these systems to serve you better. Thank you.
Thank you very much, Gilbert, for this great overview of the systems. So, dear participants, as you can see, the system is really one and is here to integrate all the information that we are getting from IDSR, from EIOS, from scanning those media to find signals. If the signals becomes events, and when there is an IMST that is setting up how these events are being monitored on a regular basis, and when the events have been closed. So also regarding the IDSR, starting from facility level to district level, national level, on a weekly basis regarding all diseases under surveillance. So putting together all those information in one systems can help us to understand, to have a great overview of what is happening in Africa and help us to best monitor diseases. So now we will go through questions and answers. So colleagues, I will give the floor to Dr. Emmanuel, who will moderate these Q&A sessions. If you have any question, you can raise your hand, but also there are some questions in the Q&A. Dr. Emmanuel, over to you.
Yeah, thank you very much, Dr. Saliu. I believe colleagues have listened carefully and understood the presentations. So now we want to take your questions. So if you want to ask a question, just raise your hand and you'll be given the permission to ask your question. And the panelists are ready to respond to your questions. So over to you, colleagues. So as we are waiting for any live question, I'll open on the questions and answers and read some of the questions.
Dr. Emmanuel, there are some hands raised.
Yeah, some hands raised, okay. Yeah, can I see?
Hello, oui, bonjour.
Good afternoon. Good afternoon. My name is Sila Mohamed. I'm a data manager from country office in Guinea. Can you hear me?
Très bien. On vous reçoit, vous pouvez y aller.
Yes, please go ahead.
Oui, on vous entend très bien.
Voilà, je me présentais, je disais que c'est
Yes,
Sila
I was
Mohamed,
saying that
chargé de la
my
gestion
name
des
is
données
Sila
au pays
Mohamed.
Guinée.
I'm in charge of
J'ai suivi
data
avec
management
vous les
at
différentes
country
présentations
office
et j'apprécie
in Guinea.
beaucoup l'outil.
I follow the presentations and I
Je sais que
pretty
c'est
much
toujours un pas
appreciate
de
the
plus en
tool.
matière de
It's
renforcement
always an
de systèmes
advantage in
sur
terms
les
of
différents pays. Moi, j'aurais juste
surveillance
une
system
question, du moment
strengthening in
que
different countries.
l'EUS, nous
I
connaissons
have a
déjà
question
dans le SIA en matière de
regarding
suivi
the EIOS
des
in
signaux
terms of
qui est là
monitoring
déjà
of
et avec
signals
ce
that
outil
already
aussi qui va
exist.
être le DHS2.
And
Est-ce qu'il y a une
in
possibilité
perspective of the
d'interconnexion entre ces systèmes
DHIS2,
sans qu'on ne
can
fasse la
we
double saisie,
interconnect
c'est-à-dire
both
qu'on ne saisisse
systems
dans
to
l'EUS, mais
avoid
qu'on ne le
double
transfère
data
derrière
entry?
et puis
Can
qu'on
we
vienne
track
saisir
it
aussi encore dans le
on
DHS2
EIOS
et de voir s'il y a une
and
interopérabilité
not
qu'on nous
do it
partage cette idée.
again on
Et puis, par
DHIS2?
après, si c'est
Can we
possible, à la fin de
make
la
a
session,
smooth
qu'on a seulement le but d'être
interoperability?
partagé.
And can you
Merci à
also
vous.
share the recording at the end of this session? Thank you.
Merci beaucoup, Sila.
Yes.
Thank you very much,
Question
Sila.
bien noté.
We've
So,
taken
Dr.
note of
Emmanuel
the
is going to
question.
take the other
Dr.
hand
Emmanuel.
before maybe giving the floor to the panelists.
Yes. So can we get a response to this question?
Okay, so
Please, can Gilbert respond or?
Sure. Yeah. Yeah, I can see some questions in the QA and also my colleague. So we can provide. If I can say, when we started, working on the platform, we wanted to have integration with countries' systems. That was our end goal. But along the way, we saw that there was some, resistance in some countries by May, because in an automated way, one means that maybe if we reach a certain date, we have a report pushed into the system, or have someone maybe review data and push the data. So we saw that it was it needed some steps, with countries to ensure that they are okay with the data that will be pushed within the system. Then we said, why can't we maybe make it as a process? Start with the phase that can make it easier. Look at what is available for now, because each country was reporting on a weekly basis using an Excel file. Move it, from sending by email and try to make it possible for countries to access the system, just upload in an easy way. And now we are having discussions on how we can now engage with countries that are willing to have this direct connection, because we have APIs enabled and we can easily integrate. So after I think the webinar, we get in touch with some countries that we can start with and start, working on these direct connections. So that's where we want to go, and we're happy to work with countries.
Thank you very much, Gilbert. Can we have more hands up?
Yes, we have Dr. Livinius.
Dr. Livinius, you have the floor.
Yes, thank you, colleagues. Good morning, everybody. It just for me, I am very happy at these presentations. Thank you for these innovations. Two quick ones. One, what's the basic difference between the signal event management system and EIOS? Is it on further analyzing the signals from EIOS? I would really want to know. Second, this tool, can it be further scaled down to the country levels to represent the provinces, the districts, the health facilities data, or will it be only available at Afro level to manage countries' data? Thank you. Over.
Yeah, thank you for your question. I believe Dr. Etienne will start and Dr. Gilbert will continue with the response.
Okay, I can start with the last part of the question. I think there were two questions. The The first one was related to the EOS, but Gilbert will answer. But the second one is really important. It is, so this is, we don't build tool for Afro. Of course, we want to have a regional view of the data and see where things might happen. But at the same time, our primary goal is really to support the countries. So what we're trying to do is actually get countries to use this for themselves, really, or integrate it or part of it into what we already have. For example, we've seen countries that have already some DHIS2 platform, but there are some specific tools in here that they can actually just grab, integrate into the own platform. We've been talking. So basically, I think it's on a country by country basis, because their countries are at different levels. But ultimately, what we really want is to have the possibility of every country to have that potential. So to answer your question in a very easy and straightforward way is this is really for the countries to be used. Of course, regional level will continue to coordinate and provide more regional level analysis, but it's really meant for the countries. So we hope, and that's why we do having this webinar to, number one, show it, and then for countries to really express their interest and adopt it really, or say, well, perhaps we don't have such a tool yet, we can integrate it, or we actually have something already, but we want some pieces of it to be integrated. And that collaboration, that talk should be ongoing. And then I think some of the part of the question was also related to the subnational levels. So if the country is actually using this, depending on their capacity, I think, which we can of course work with, this can be decentralized to district level, for example. Actually, in the configuration, you have a district in there. We can even, moving forward, get it down to very low level of reporting, because the challenge is really how the countries are getting the data from a facility to actually have an aggregated level of district level, basically, and how this kind of tool can help. For example, if we introduce mobile reporting, to replace some of the form, basically, the data can be captured remotely and centralized directly at the district level. So there's so much that can be offered. So the discussion now is really on country by country basis. Where do we go? What's needed? And that's where we are really. So, Gilbert, if you can address the first part of the question. Thank you.
Yeah, I think we are open to support countries, to have the system usually even at the level of the country. I think you mentioned the need. The system have different levels of work. So depending on the configuration, on the user and the level of work, anything can be done in that direction. So we are open to have further discussions and to see how we can engage with countries, and one who needs access, we normally plan a code and run you through into more details how you can use the platform. Then you can move from there. I saw some also who had some questions, some threshold analysis, whether they were based on country specific threshold analysis. So we started with the general threshold as is algorithms, but our idea is to work with country by country to define for their specific threshold analysis that they may be having. And it's not based only in saying that, maybe if one case is reported, we have to take it as a threshold. So we take into account also the population for some diseases and some other criteria. So it's not based only on just having a number of a case. It's a mix of different criteria that we base on. Then we can say that this from the threshold analysis, this is part of the notification that we have to set out. I don't know if I need to.
Yes,
the
thank
question.
you.
Well, yeah.
Thank you very much, Gilbert. Just to complement, as you know, we have the IDSR guidelines. So whatever you will see into the systems comes from those guidelines. Regarding the threshold analysis, the recommendation from the guidelines, those are the recommendations that have been implemented into the systems. Thanks. Back to you, Dr. Emmanuel.
Yeah. Thank you very much, Dr. Etienne and Gilbert, for the brilliant response to the answers. Any hand up again? Can I see any hand? Then let's look at some of the QA questions.
We have other hands on.
One other
We
hands,
have
okay.
Someone, Obo, over to you.
Mhm.
Can you hear me?
Yes, we can hear you.
Ok. Je voulais poser la question, c'était
Yes, I would like
vraiment
to ask the
intéressant
question. The session was pretty
avec
interesting.
l'explication du
I
docteur
think even
Etienne
Dr.
à cette
Etienne's
proximité entre
explanation
les pays
with the
et
proximity with
l'IDSR,
countries
c'est quelque chose que je
and
pense qu'il faut continuer à
IDSR
pousser.
is something that
En
we
parlant
need
de
to
ça, en fait,
encourage.
côté afro-régional,
Now,
dans
on the
notre
Afro, at the regional level, I'm Junov
ma
Obo
question
from Afro.
était que
My question
je comprends
is,
la
I
plateforme
understand
souhaite avoir vraiment une
that the
proximité avec les
platform is
pays.
looking forward
Je suis
to
convaincu.
proximity
Mais
with
aussi, de
countries.
l'autre côté,
I'm convinced, but
au
on
sein
the other
d'Afro,
side,
on aimerait aussi
within
pouvoir
Afro,
être
we are
capable,
also interested in
non pas seulement d'accompagner les
not
pays,
only
mais
to support
d'apporter des
countries, but
réponses
also
à
to
leurs
bring
événements ou en essayant
answers to their
d'apporter des
events.
solutions avec,
We want
avec
to
une
bring
planification de campagne de
solutions
vaccination et bien
with
d'autres. Ce que
vaccination
je veux dire
campaign
par là, c'est
planning
que
and
ensemble,
more.
est-ce que
What
c'est
I mean
possible
is
de pouvoir
it
en fait se
possible
plugger,
to
fetcher
plug ourselves
quelques données,
or to fetch
mais
data, some data,
pas que manuellement,
not
en essayant de
only
cliquer, en téléchargeant,
manually, but
des
by
tableaux
maybe
ou
clicking and
des
downloading
tables sur
tables
la plateforme, mais
that
vraiment de
exist on the
manière
platform.
assez fluide.
I'm talking
Est-ce
about
qu'il existe une API pour
something which
ça?
is
Ça,
flawless.
c'est la
Is
première question.
there
Deuxièmement,
a
en fait,
process for
pourquoi
that?
je parle de ça? C'est parce
Question
que
2.
j'ai vu
The
que
reason
sur la
why I'm
partie
talking
où
about that is
il y
because
avait sur la
I
compléteness, il n'y
noticed
avait
that
pas énormément
on
d'informations.
the
Donc, ça
completeness,
permettait
there was
aussi
not much
à nous
information.
de pouvoir faire du
So this
suivi
helps
et de
us to do
renvoyer avec
monitoring
les pays pour
and
qu'ils
to
puissent
interact with
renvoyer
countries so that those
des données,
countries
des
may
informations. Je
share
suis bien conscient que
some data or some
la
information.
partie sur la
I'm
plateforme
aware that
de
on the platform
l'IDSR permet aussi aux pays de se
of
rendre compte que les
IDSR,
informations
it
qui nous
helps
sont
countries
remontées
to see
ont une
that
importance
data they are
significative
sharing that
par rapport au
with
suivi.
us are
Donc,
very
c'est pas
significant
simplement
with
ça, et
respect to
toujours
monitoring and
merci,
follow-up. And I would like to take this opportunity to thank you for always informing us more. Thank you for sharing your information.
Yeah, we thank you.
Thank you.
Obo. Can we get response from any of our panelists?
This was more or less a comment, but I can quickly say something about it. Thank you so much for the. Merci beaucoup. C'était en français. So,
Yes, he says it was in French. Let me speak in French.
So really, what we really want and hope for is a maximum use of the platform internally at Afro, at the hubs, countries, and hopefully it can even go beyond. I mean, to partners, for example, who are supporting us. Of course, we are working on some details, but really, if what we have started is some specific needs, for example, for VPD, and I have actually encouraged the team to link up to see what can be done really for them for the VPD team, for example, to follow what is going on. We have already a very good use case with the meningitis team, for example, where we are already comparing what they collect as data when they go to the ground compared to what is in the IDSR platform that country themselves submitted. And so there's so much, and there are things that already exist, what to generate for who, but I think it will also come more from the request side of what else can we put in there that can be generated and communicated directly to which group, so they can use it. Overall, internally for the programs, for what we really want is to have a full use of this so that they can, like you said, to follow up the countries. And I have mentioned the meningitis case, which we are very happy with because it's really ongoing already. And we are addressing some of the data quality challenges already, meningitis. Thank you very much for that.
Thank you, Dr.
There are a
Etia.
lot of questions in the chat. Let's make sure we capture.
Let's look at some of the questions from the chat. There's a question from Mohammed Abdul Karim. He's saying, good morning. I noticed the completeness in reporting for the IDSR panoramic view and other dashboard data is very poor. What is being done to improve that? That is coming from Mohammed. Can we get any response for that? I think this IDSR panorama, the completeness there is poor.
Maybe without going into details, and of course the team can check, this is exactly what we hope for, to actually identify weaknesses where that can be addressed. So, for example, in some specific countries, we're seeing some challenges, and in some cases, we have even provided specific TA on the ground to help address the challenges. We've done it in Mauritius, Equatorial Guinea, Angola, and so on. So when we know something is really going on, specifically on the reporting side, we try to engage the country. Flory, Emmanuel's team are really engaging the country for that. So it might be, a reflection of status of that is seen on the panorama parts. But yeah, that's a brief answer that I can give.
Yes, to also add to that.
Yeah, let's make sure we
are monitoring closely all the countries. There's a question?
There is a hand up, and then
there's a hand up.
Questions, unless it's a not end.
This is an old hand.
We have two and
old hand.
Okay.
We have Charlie, we have Regis, Dr. Emmanuel. We have two hands on.
Two hands, okay.
Yes.
Let's give them the floor.
Let's start with Charlie.
No.
Okay, good morning, colleagues. Thank you for the presentation, and thank you for the presentation and the demo. Me, I always wonder. I'm calling from. I'm joining from DRC, Kinshasa, WHO country office. I always wonder when we are talking about countries, are we referring to WHO country offices, or we are referring to member state Ministry of Health when we are when we talk about countries? Because my own experience is when it's come to these data management systems and solutions, infrastructure we put in place. Most of the time we are facing a challenge with the MOH, because I think one of the missing item on setting up all these platforms and willing the MOH to contribute is a lack of governance of these systems, lack of governance of the infrastructure which is sustaining the solution, and lack of clear policy governance in terms of the data which has been collected or shared or should be shared between the MOH and the WHO platforms. So I don't know how far we are with, should I say, agreeing on a kind of MOU between the member states Ministry of Health. But I've noticed that is one of the big challenges. And it's so important because sometimes we assist or we help the ministry to collect the data, but they want to keep the data for them, and only when they want to or when they are willing to, they agree to share some of the data with us. When I'm saying with us, I mean with the country offices, the WHO country offices. So I think that is something we have to Maybe I'm not aware, but I think it's something if the policies are in place, I think it's something we have to scale down with at the ministry level, so that we can have kind of completeness of I mean, we can easily they can easily share.
Charlie, can you run up with your question?
Yeah,
so that we
yeah.
can respond quickly.
Okay, now the last one is most of the time we recommend the MOH, the member state, to set up the same platform, the DHIS2 platforms at their level. And then we also have our own platforms at the WHO, at WHO level. So it's become how these platforms from the ministry and from the MOH, they integrate or they communicate or they share information. That is also another challenge most of the time we were facing. So those are my 2 points I wanted to highlight. Over to you. Thank you.
Thank you very much, Charlie. Maybe we'll call on Dr. Etienne to start with the policy level of reporting and then the integration of the data at the country level with the platform at the Afro level. Dr. Etienne, over to you, please.
Yes, thank you very much. My connection is not so good today. I moved to another office. So, the first question, the first part of your question, for IDS, of course, we are planning actually another webinar very soon to talk about data sharing agreements, data use. When we say member states or countries, we're actually referring to the member states, so the ministries of health and others. It's not the country office of WHO that we're talking about. So for the IDSR, luckily, we are the only WHO region that has this strategy working very well. It's well documented. It has been approved by the ministries of health. So there is, a formal documentation of it, and we have to actually report back at every regional committee on IDSR progress for the country. So the countries are committed. We actually congratulate them for what we are doing. And so sharing IDSR data is not a big issue with us, with WHO. The idea is we want to make sure the data is collected, and that's the challenge. How do we collect it actually? And so that we have it in a good quality to be able to share. So that's one thing. Now, the other part of your question on the platform. So at the regional level, what we're doing is a centralization of the data for the region. And so as you could see, you have the data from all the countries, so we can see what is going on in every country, every district, and so on. Countries have their own systems, of course, that's what we encourage. And then what we have also been advocating for is to link, for example, countries that have the DHIS2 to, at the end of every week, basically, is to pull or push the data to a centralized platform, which is sitting at home. So that's where we are going slowly. So I don't think there is duplication or anything like that. The countries know that this is a tool that is out there for them. Now, the analytics that are embedded can be used, as we log on as a country, but you can also say, well, we want probably to take it up, put it in our own system locally. That's fine. But the data has to be somewhere, and that's what we are currently doing. But thank you for that. Any other question? We are running out of time. So
thank you, Dr. Etienne. I think we have come to the end of the questions and answer session. But the various questions that you have asked in the Q&A box will be responded to and shared with the respective colleagues. So thank you very much for your active participation in the Q&A session. Thank you. Over to Dr. Saliu.
Thank you very much, dear participants. As Dr. Emmanuel said, we will try to address the questions that have not been addressed during the Q&A, and we will try to share those answers with the slide that have been presented. Now, I will still give the floor to Dr. Etienne for the next steps and the concluding remarks. Over to you, Dr. Etienne.
So thank you very much, Saliu. I wanted to just show one slide, but I think in the interest of time, because we're already exactly at 11:30, I will just say a few words. I know we didn't manage to answer all of the questions in the chat. I tried to answer many of them, but I think it will be important to address all of those questions. There were questions related to AI use. Dr. Bashir mentioned that. I tried to answer it. So in many of the processing analytics that we are suggesting or implementing, it's really how much we can use machine learning. For example, when we talked about alert threshold, it's almost impossible to do it manually or even with a small script. So those are things that are being implemented behind, automating the alert threshold, sending messages automatically to the countries when something is in red, for example. So those are really AI powered. We're also using AI on the side of a text classifier to actually help our team here to go faster in terms of media monitoring through EOS. These are things that also will come up in the next version of EOS, so likely we'll have more potential to reduce the burden on our teams that are doing media monitoring, not only at Afro, but also at country level. As I mentioned, 42 countries already have been onboarded on EOS. There were many questions around access to the platform. So this is something the team will come to discuss with you. Basically, there have been some work already done. The focal point of surveillance in the countries have had access. But if a specific country does not have access or individual, I think it will be important to link up with a team for them to grant access to you. There were questions about data sources, and I think that was probably from other people who don't understand our context. But basically, the data is coming from the ground, from the ministries of health on the ground at district level, aggregated later at national level. And then, of course, they share it with Afro because of the regional coverage that we're trying to provide. But it's really country level data. And then last point of the data sharing piece, again, it is important to understand that IDSR data is really simple. It's about the number of suspected cases, a number of suspected deaths by district for every priority disease for the country. So something that was really agreeable for sharing. So what we're hoping for is for countries to really share information among themselves. We're seeing a lot of events going on, and we have been involved in the cross-border surveillance project, for example, where countries are really expressing interest in learning from the other countries, seeing what is going on near the borders and so on. So we will go slowly to that level. In terms of, there was also a very important point of the EMS2 and what we are doing in Afro with our SEMS, which is the event signals and event management platform. This is specifically for Afro to really have a handle on the signals and events that are ongoing on the ground here. It actually has more tools in terms of the teams taking actions in the verification processes and everything. So it's a little more adapted to the context, but obviously at one point we'll see how, and we want to actually supply or give the data back to EMS2, for example. So it's not an additional tool, it is complementary. I would really want to thank everybody, and I will stop here, but the last word that I wanted to give is on collaborative surveillance. And that was my slide, but I will just leave it there because we don't have time. We'll share the slide deck and you'll see it in the slide deck. So we are moving slowly to collaborative surveillance, which is really, and that's also addressing one of the questions, going beyond One Health. They have multi-sectoral surveillance that we are looking for. For example, integrating data from transport, from education, from other sectors is very important to achieve our goal of detecting early. If things are happening in mining, for example, how can we really detect those easily? That goes beyond one health. Of course, maybe the environment side, but usually the Ministry of Mining or oil, they have specific ways of dealing with their own data, and how do we get information from those sectors? And that is the next priority for us, to move very quickly of how to integrate data, what kind of simple architecture we can come up with to have that interoperability, to come up with very important indicators that will help us understand what is going on, to be able to detect. And I will also say that AI, machine learning is really the basis for many of the things we are doing, and I'm repeating it, but it's important that the volume of data we're dealing with is almost impossible to continue to do the traditional ways of doing analysis. And we have to make sure we can automate things. And then lastly, the country support. So all of these tools are really for countries, the member states to use. So maybe are we talking about the ministries and the departments to use or integrate? And so that's where we really want the member states to be engaged in what is useful for them, and continue that discussion. All right, let me stop here, but I really want to thank everyone. We were almost 200 and almost 240 people on this call. It was really amazing, and the discussions were very, very fruitful. So really want to thank everyone for this. We'll have more webinars, and we'll have more topics moving forward. So thank you again, and have a good rest of your day.
Thank you very much. So, bye-bye.